Welcome to the Continuing Education module, Trends in Health Plan Wellness Offerings, Improving the Health and Wellness of Health Insurance Plan Beneficiaries. Our agenda for this module includes the following topics. First of all, we want to true up on our definition of wellness, then have an overview of the health plan community, then a characterization of the major market segments, the individual market, the small group market, the large and self-insured ASO market, and then health plan employees. And we want to also be looking forward to what kinds of things are likely to be happening on the trends affecting health plan wellness efforts. And finally, a summary of main points. Our definitions of wellness we want to touch on briefly and just highlight that we look and think about wellness as an intentional choice of a lifestyle characterized by personal responsibility, moderation, and maximum personal enhancement of physical, mental, and financial health. So that's the context that we're dealing with in terms of what wellness is as we think about wellness programs in health plan settings. The second part of the definition is that a worksite wellness program is we define as an organized program usually in the work site, although it doesn't necessarily have to be the place where all of the wellness is delivered to the groups and individuals involved, that is intended to assist employees and their family members in making voluntary behavior changes that reduce their health and injury risk, improve their health consumer skills, and enhance their individual and family wellness, productivity, and well-being. This context for worksite wellness programs is really designed to provide you with a lot of latitude, but at the same time also include aspects which we oftentimes don't include in our thinking about wellness. So that's why you see the injury risk issue, the issue around the health consumer skills, and then the ability for us to bring together our concerns for productivity and well-being in that definition as well. Now, an overview of healthcare expenditures looks at by source. We see that the private health insurance marketplace provides about 36% of all the source of funds that flow through the healthcare system. The type of expenditure, where it flows to, we see characterized here, so that the majority of funding that comes through private health insurance coverage is essentially going to focus on the hospital setting, physician and clinical service settings, prescription drugs, and then probably in terms of dental and vision, a small amount. But that's where the general flow from the source, the private health insurance organization or health plan, and then to the types of providers that are generally involved. Now, the overview of the health insurance and health plan community. We have more than 1,400 health plan entities in the U.S. That covers about 200 million individuals. That underwrites 90% of all the accident and health business in the U.S. And the sum of these health plan entities also covers more than 90% of all managed care enrollees. And it includes approximately 63 Blue plans, Blue Cross Blue Shield plans. There's still a great deal of adjustment going on to the existing rules in the ACA and the exchange dynamics, both private and public exchanges, and how that pricing essentially affects our health insurance and health plan community. Competition is intensifying, so there is more competition between health plans, more market and market penetrations are being made, and we also have more uncertainty ahead under the new administration in terms of changes to the ACA, the repeal of some provisions, the modifications of others. So this characterizes, in a sense, our health insurer and health plan community. Now, the pattern of health plan wellness, we can also liken back to Shoemaker and Rogers, their work in the diffusion of innovation. And we can generally see that the early innovators and early adopters tend to be the health plans that have made more major investments in wellness. And that probably is in the area of 15 to 20% of the health plans, the 1,400, have made a more extensive investment. We also have some that have essentially got on board early and have a range of wellness services. We're going to look at what those are and how they are arrayed in a moment. We also have some that have come in more recently, and we also have some that are not likely to be having much wellness activities offered to their clients and beneficiaries. So we have this pattern that I think follows to some degree the work that Shoemaker and Rogers have done about the diffusion of innovation. Now, what all health plans have in terms of wellness are generally health risk assessments, sometimes called well-being assessments or well-being surveys, weight management programs, smoking cessation programs, on-site biometric screening, Medicare Advantage plans, so plans that are under the Part C of Medicare, the preventive medical benefit design and offerings, educational programs that are targeted on specific issues in wellness, a health advice or nurse advice line function, an e-health portal, disease management programs, and selected print materials. So in general, my experience has been in working with health plans across the country that almost all of them have these core set of wellness interventions. Now, when we start to move into the characterization of various market segments, let's start first with the individual health plan member or health plan subscriber. And that market has relatively few wellness experiments underway. There's no wellness pools that I know of in the country around individual plan members. There are some around small group settings and medium-sized employer group settings, but none that I know of in terms of individual market. Very little wellness built into plan design. So not a lot of plan design related wellness in the individual market. Mostly perfunctory in terms of some of the mention and some of the involvement of wellness issues. Fairly heavy communication emphasis. So there is definitely communication that goes out to the individual health plan member. And many rely on the eHealth portal and the general website, even though they lack oftentimes incentives that would lead to people's use of those eHealth portals. And virtually no coherent incentive system that I'm aware of in any of the individual market segments. So that we generally don't have a lot of the incentive methodology, the incentive infrastructure for this individual market segment. Now, let's go to characterization of the small group market, and that can be defined differently by different health plans. I believe that there are a moderate number of experiments in wellness underway with this particular segment of the market. There are a few wellness pools that I'm aware of where if an employer is to use that particular pool to cover the liability and cost of their health benefits, they then have to have some ability to be doing certain kinds of wellness. So the kinds of things, for instance, like having a C-suite briefing on wellness or having a committee or a strategic plan on wellness in place, or having 6 meetings of their employee advisory meeting, or offering a HRA to the employees of the company. Those are some of the examples of various features that I've found in health plan wellness related insurance pools, particularly around the small group market. Also increasing demand from employers. So I think the sense of things that I get as I talk to people in the health plan community is that more of these small employers and small groups are in fact asking about wellness. Heavier use of virtual methods. So there's more reliance not on site-based wellness, but on more of the virtual kinds of interventions. Few incentive experiments are underway, and some printed materials and portal available to the small group market segment. Only one health insurer that I know of has made a commitment to provide dedicated consultation on wellness to this small group market. So, and I think that we'll probably see more doing that, but at least right now, not a lot have invested, health plans have invested in wellness in this particular market segment. And this segment may in fact go from, say, 10 lives on up to maybe 250 lives. So this is the general small group. Let's characterize the large and self-insured market, and that usually picks up around 250 and moves upward. These are often ASO, Administrative Services Only contracts, so the liability for healthcare and healthcare costs for the population is usually covered by a combination of reinsurance and the employer taking most of the responsibility for the payment of claims for their employees and family members. Lots of wellness activities in this particular segment. Much customization and one-offs. So a lot of individually designed, individually crafted kinds of wellness efforts. Many creative incentive programs in this segment. Few medical self-care and consumer health interventions. They're on the edge and the periphery of activity, and generally weak personalization efforts. So we don't see as much use of computer personalization to actually help craft our program and to adapt it more readily to the characteristics, preferences, needs of the individuals that we're dealing with. Now, let's also characterize this last segment, which are the plan employees. So these are oftentimes the employees that are part of a blue plan or part of the commercial insurer that's offering health plan coverage, HMO coverage, or point of service, or PPO, or exclusive provider organization, EPO types of coverage. About 40%, I would estimate, have active wellness programs. So we have some level of activity going on, not every plan, but certainly a major portion of the plans. Generally, the design of their programs are what I would consider to be traditional activity-oriented programs with a $100 to $200 incentive level around a variety of wellness activities. So that probably, to me, characterizes most of the health plan activities out there for their own employees. They oftentimes are demonstrating some value to plan actuaries, so there is that feedback loop of being able to look at the plan employees and how the wellness is affecting their spending patterns in terms of healthcare utilization and cost. This often functions as a beta or a lab test group. So the ability to have the plan employees actually have access to things that are coming up and that are being created in terms of wellness services is oftentimes the model that you find among those 40% of the plans or so that are actively involved in wellness for their employees. Limited targeting, so we have a fairly narrow range of targets, sticking pretty much to the big 8, not getting too far beyond those. Having some of the communication and eHealth portal activity oriented to some other targets, but generally having a fairly narrow target range. And a limited intervention mix. So we don't have any real depth in terms of intervention in the health plan, in the employee programs, but in general, this fairly limited intervention mix. And few leaders. So we don't see, I don't see a lot of emerging leaders when it comes to the 1,400 or so health plans or health insurers in terms of their, true leadership ability and using this particular segment, their own employees, as the segment that they're experimenting with or they're providing wellness for. Now, the overview of health plan wellness efforts in a 2x2 analysis, where we look at on the left the adequacy of funding and on the top the effectiveness of the programming, I would probably suggest that about 75% of health plan wellness efforts overall for all of their both plan employees as well as their various market segments are probably going to be in that A, because I think that also parallels a lot of what we see in the employer community in terms of programs that are underfunded and relatively ineffective. They may show some results in a few areas, but not anything that's really powerful in terms of the impact on health or the impact on some of the economics of health plan cost. Now, the major health plan wellness trends as we look forward, I would suggest are these. First of all, I see a continuation of the beginning increased shift to well-being and talking about total health. So the more innovative plans will in fact bring in the total health issues, which deal with health protection and safety issues, environmental issues, ergonomic issues, in addition to the well-being aspects of the newer wellness activities. Also, a general trend that I see is a reduced interest and focus on clinical and risk factors. And that comes along with a little bit of the shift to well-being emphasis is we tend to drop out of the equation some of those specific clinical and behavioral risk issues. I also see a trend of increased emphasis on intrinsics and the intrinsic motivation behind behavior change around wellness, and also a concomitant increase in interest in sleep issues as sleep becomes a more important issue from the context of the epidemiology and morbidity of issues with populations. Another trend that I see affecting health plan wellness is simplification of targeting and programming. And that really comes from essentially driven by the desire for efficiency and the desire for easy replicability and easy use of various wellness interventions. Another trend that I believe also characterizes the health plan community is a greater emphasis on community service and contribution to community, so that our wellness programs are picking up more of a philanthropic issue, fundraising issue, community involvement issues, service issues. And I also see a trend of our wellness program activities in health plans moving further along a continuum of what I call vendorization, so that the programs lose their sense of ownership by the employer and the ownership shifts more to the health plan. I don't think that's a particularly good trend. I think it's been happening for a number of reasons, but I do think that we are going to continue to see this vendorization phenomena going on, even though I do think that it has some negative consequences to how effective the programs are and how much focus and interest and support are provided by the employer for employees to engage in the wellness activities. I also see greater reliance on technology as a general trend in health plan wellness efforts. And I think that that is increasing on the employer side. It's also, I'm seeing a corollary on the health plan side. Another trend that I think characterizes this segment of the market and our economy is a softening of economic emphasis. And that, I believe, is also unfortunate. So the tendency for people to say it's too complicated for me to look at the economic effects of my program, even though I think we've been misguided in our approach to the economic return methods to have been too swayed by academic level interests and academic feedback in terms of what constitutes a reasonable approach to the economic analysis of return for these wellness programs. But I do see a general softening continuing. I also see a growing focus on active engagement. So I think we are going to see more focus on the part of health plans to actually see how to catalyze that active engagement on the part of employees that are using health plan provided wellness activities. And the last trend that I see affecting the health plan community is some loss of focus on incentives. And I think that we've gone through a lot of unfortunate discussion in our field around the role of incentives. I don't think that we have really done a very appropriate job at finding the right balance of how to mix the various pay values in incentives and how to help our extrinsic based incentives actually become more intrinsically powerful in terms of leading to long-term behavior change around wellness-related issues. Now, let's look at some of the factors leading to greater health plan wellness efforts. If, first of all, employers begin to demand more of their insurers and their carriers to increase wellness efforts, that's likely to increase investment on the part of health plans in wellness programming and strategies. If beneficiaries begin to demand more increases in wellness activities from their health plans, that's also a issue that will increase the amount of health plan wellness efforts. In addition, if there's increased pressure for vendorization coming from the small, medium, and large size groups, that's likely to also affect health plan decision making. And if our medical cost trends tend to increase with the uncertainty around the ACA's repeal and revision, that is also likely to increase pressure around health plan wellness efforts. Another area that could, in fact, increase the amount of health plan wellness efforts is if knowledge begins to increase about the general economics of worker health and its relationship to the issues around national debt and the issues around how our employer community is being faced with those costs could, in fact, increase the amount of wellness effort. In addition, if competitive pressures increase between the health plans as to maintaining or increasing market share, that's a place where some of that competitive pressure could lead to greater wellness investment. And in addition, if there is legislative activity, particularly at the state level, that if they will increase the amount of pressure put on health plans to provide wellness activities, that's also another place where health plan wellness activities can increase. Now let's summarize some of the key points from this particular module. First of all, health plans have generally been slow to innovate around wellness. They've been slow to respond in general. Employers have moved more quickly, and particularly the medium size employer has been more aggressive. There is a wide range of wellness capability among health plans, but few beneficiaries use the programs. So our problem is that we oftentimes have a range of wellness programs on the shelf in our health plan, but few beneficiaries to the plans actually use them. None have really aggressive or results-driven wellness programs to my knowledge. So I don't see the equivalent in any of the results-driven wellness efforts on the employer parts duplicated by efforts that are independently done by the health plans. I believe that many health plans have responded to employers that have demanded more of the results-driven wellness model, but not necessarily been the leaders in that issue. Also, plans tend to perceive that they are experts at wellness. So part of our difficulty is that the health plans themselves believe that they're doing what they need to be doing in wellness and aren't necessarily as open to asking the question, what should they be doing in wellness? Typically, less than 10% of their members complete an annual health risk assessment. So even when they have a well-being assessment or any kind of vehicle for collection of information, there tends to be fairly low percentages of their members that actually complete them in a regular pattern. Health plan wellness activities vary by major market segment. So each of the major market segments we've characterized in this module tend to have very different kinds of wellness activities. A few health plans are in the lead. So there are definitely in the commercial space and in the blues, there are definitely a few plans that are in fact leading the way. Many carriers and insurers over-rely on underutilized e-health portals. So part of our difficulty is we don't have adequate incentives to really lead to fairly high levels of use and effective use of those e-health portals. In general, most plans rely on virtual or passive wellness interventions. So they are essentially relying on those things that are not as active or as far-reaching or as engaging. Plans tend to try and match their major market competitors on wellness capabilities. So they aren't necessarily looking at being at the high end of their competitors. They tend to be oriented toward the having same as or mirror or look-alike types of programming. Few health plans have a range of incentive options to offer major market segments. So unless they're doing one-off kinds of developments with ASO or self-insured employers, they generally don't have a wide range of incentive options to offer. And market differentiation around wellness by health plans is still a real possibility. So there are the health plans that perceive a value in becoming the wellness, their wellness plan or the employer's wellness plan, but that market differentiation has not been well developed in most major urban markets and in each state. Now, I'd like to answer some key questions for you. The first question is, how do I convince the senior management of our health plan that we should make a major investment in wellness? And some of the suggestions that I would make to help you do that are: one, I would catalog and summarize client demands for wellness so that you can array that in front of your senior managers. Secondly, I would educate the senior managers about the economic evidence that is in our literature around wellness and around particularly the broader view of economics and worker health. The third thing I would do is to assess the accomplishments to date that your programming has provided so that they have some sense of what you've been able to accomplish. And that may essentially be a head count or maybe looking at the percent of eligibles that have received various wellness interventions to date and or some breakout by market segment. The fourth thing I'd probably do is to perform a competitor review of their wellness and health promotion activity. And that would essentially look at what are our competitors doing when it comes to wellness, and then essentially pick some major markers, either their ASO cases or the small employer or large employer or medium-sized employer or their individual groups or their health plans and health plan areas, the same kind of characterization that we went through in the module itself. The next thing that I probably would suggest you do is to consider writing out and identifying what the scope of an ideal approach would be for your health plan. And that's where you would take best practice kinds of considerations and then unfold them in terms of a descriptive piece on what that ideal approach to wellness might look like for your own plan. The next thing I do is I would probably cost that ideal project out. I would identify the resources by sector that would be necessary for it to be implemented. The next area that I probably would do is to project the potential impact. And I probably would use the Bolnick article, which is a group of actuaries that in fact we cited on earlier studies that in fact have the way in which they have looked at the World Health Organization developed nations data and then applied the medical expenditure panel study results from the National Center for Health Statistics, and essentially given a potential percentage of preventable healthcare utilization, and then have that essentially applied against what you are anticipating as the costs of undertaking this kind of wellness initiative. The next thing I probably would do is to get some major stakeholder feedback, some of the major groups from the sales group, the actuarial group, the groups that are involved in various sectors of a business or segments of business for the health plan. And then finally, I would essentially put all this together and serve it up, provided as a possibility for management to consider. So those are the things that I would do to actually convince senior management to make more of a major investment in wellness programming. The next question I'd like to address is what issues should be used in health plans to justify wellness efforts? And the issues that I would use to justify wellness efforts are: one, the relationship between health risk and health cost. So much of that epidemiologic literature summarized in various forms can in fact bring senior management and health plans to a very different kind of attitude about their wellness efforts. I would then, secondly, summarize the return on investment studies and literature. We provide a lot of that summary information. The level 1 course workbook includes an appendix that or exhibit that does in fact include an in-depth look at the economic return studies. There are about 110 economic return studies and approximately 40 or so that take it all the way to the return on investment. The next area I would probably put together would be the issues around the actuarial developments in the assessment of risk and cost. And again, the Bolnick article would be a major piece of that. The fourth thing I probably would do, an issue I would look at, is the medical trend effects on market position. What happens if we're able to lower our market trend by a factor of 25%? And that's based on the literature in wellness and health promotion. That's a reasonable expectation. So we can in fact make that kind of 25% reduction in whatever that medical trend rate is for our markets. And then how would that change our likely market position in terms of market share? The next area that I probably would work on is being able to use the issue of client demand more effectively. So I would be talking about how that relates and noting how requests come through and what level of requests there are being made. The next area I probably would work on would be the expansion beyond risk reduction, so that we are in fact dealing with other kinds of strategies like medical self-care strategies, consumer health education strategies, injury prevention strategies, advanced directive strategies, ergonomic strategies. So being able to look at how to expand beyond just the risk reduction area. The next issue that I would work on to justify wellness efforts is the positioning of wellness in terms of its health plan cost, sick leave absenteeism, workers' compensation cost, disability insurance costs, and presenteeism related costs, and our ability to use wellness to achieve earnings and savings in each of those areas. So that differentiates us as a health plan in our market space. The next issue I would probably work on is the importance of countering revenue generation and the revenue generation activity of various providers in terms of how they are maximizing their revenue through a reimbursement under our health plan to our clients and to the subscribers and members that we have. The next issue I would probably use to justify wellness would be looking at, can we use wellness as a revenue generator for our health plan? And can we counter that against a value add approach where we're simply adding some additional value by offering the wellness activity? So if revenue generation becomes part of our positioning of wellness, then that has specific economic implications for our health plan. The next area or issue that I would use to justify wellness is the market segment specific strategies, so that we would break out our segments into major groups and then essentially organized interventions around those specific characteristics of each market segment. And then finally, being able to deal with your overall market position as your wellness plan as one way of justifying increased investment in wellness activity on the part of the health plan. Our third question is, what would an ideal health plan approach to wellness look like? And the items that come to mind in answer to that question are: one, that segment-specific strategy for interventions, the ability to dial up or dial down the amount of population health management, of wellness that we can potentially use, and specifically for the ASO segment. Using also a smartphone drip well-being assessment or well-being survey with personalized offers based on a long-term relationship with the subscriber beneficiary. And then the ability to provide a consultation service for results-driven wellness for various employers who desire that. The next area would be the creation of wellness required pools, or pools that could be brought together, multiple businesses and or individual plans, individual plan subscribers, where you're doing a certain amount of wellness as part of the requirement for being a member of a particular pool, and having that be for the individual plan subscriber, the small business subscriber, and the medium-sized business subscriber. The next approach that I would suggest would be part of an ideal approach would have employees of the plan have the maximum package and use that as a developmental lab for rolling out more aggressive health, both health cost management, but population health management types of interventions. And the next item is to have a strong brand aspect on wellness, so that the health plan's brand in the marketplace has a strong wellness identity or well-being component to it. And then finally, the ability to have a formal annual evaluation process and dissemination of findings that allows the health plan to take both the community citizen, corporate citizen kind of approach, as well as to be an advocate for wellness within their locale, within their state, and within the industry itself. So that would be my estimation of what an ideal health plan approach to wellness might in fact look like. Now you've completed this particular module, go ahead and take the quiz.